It is exactly 36 minutes past the hour. Welcome back to Sunday Live here at Citizen Television. On to our feature of the evening. And as the world marks 16 days of activism against gender-based violence, teenage pregnancies and access to maternal health care for adolescent girls remains a challenge. While Kenya recorded a 15% increase in the number of adolescents aged between 10 and 19 years who sought antenatal care at various health facilities between March 2020 and March 2021.
Nevertheless, the lack of specialized care for this group has been cited as a key reason why most stay away. Mashirima Kapombe had a sit-down with various stakeholders on the gaps that are yet to be addressed despite a 2015 policy that was supposed to be the game changer in the sector. Here now is our special report, and the hashtag is Teens of Burden.
The beginning of a new day for residents of Nairobi County. A sunrise with a promise of better tidings for teenage girls at the Maisha Girls Safe House. 36 girls live here. This is their place of solace from the realities of their past. Subira, not her real name, is a 15-year-old mother of one. She was forced into motherhood after a clergyman defiled her.
Ilikuwa on Saturday, wakaniambia tuende tutengeneze church. Mimi nikatoka nao tukaenda tukapanga church vizuri. Wakaniambia niende niongee na pastor.
After they concluded cleaning the sanctuary, the pastor sent away her two friends and took her home with him, claiming her friends would be there.
Mimi nilikuwa nafikiria tutapata wasichana wametumwa huko hivyo. Mimi nikaenda. Ndio sasa huyo pastor akalala na mimi. After that, mimi niliogopa nikatoka huko. Mimi nikaenda nikaoga, nikavaa nguo nikakaa kwa nyumba. Mungu akakuja, akaniuliza nilala wapi, nikamwambia yote. Nilijua nikimwambia hiyo pastor atanigombanisha. Mimi nikanyamaza tu. Sikuwa najua kama niko na mtoto.
It was only months later that her teachers discovered she was pregnant.
Walimu wakaniambia siko venye wala kwanga. Tukaenda hosi. Ndio nikapima. Wakasema niko na mimba ya miezi 7.
Subira's mother took her for her first antenatal visit at a nearby health facility after police officers directed her to do so.
Polisi akatuambia, aliongelesha mamangu baya. Akaambia mamangu, huwezi tuambia mtoto wako na ball na hujampima, haujaenda hosi na hata hamna kadi ya hosi. Nyinyi mrudi mtafute hizo vitu zote.
They went back to the station and got an OB number. Her mother brought her to this safe house where she was able to attend a second clinic visit before she gave birth.
Wanaenda, but tunapata watu wakubwa tu sana kuliko mimi. Azini wananiangalia, wanaona mimi mdogo.
Florence Care, the founder of the shelter, says the girls come to the home broken by their experiences and clinic days are nothing short of traumatic.
Because when you go to the hospital, there's so many questions that these girls will be asked. And sometimes they block, they don't talk. How the pregnancy came. When was the last time you received your periods? They can't even remember. They don't want to remember those bits of things.
Kiza, not her real name, is 16 years old and 7 months pregnant. Her pain is evident as she relieves the horrifying ordeal. A neighbor defiled her several times, only to find out months later she was pregnant.
Venye nilienda kumwambia akaniambia nitoe, mimi nikakataa. Kaambia mimi nitaambia mama, akasema nisiambie mamangu.
Kiza did not seek antenatal care at first.
Singeweza kwenda peke yangu. Ilikuwa lazima niende na mama angenijua angenipiga.
Kiza's mother kicked her out of their home when she discovered her condition.
Nilienda kwa mama mwingine hapo. Anafanya kwa nyumba 10. nililala kwake hiyo siku.
They reported the defilement at a nearby police station and she was taken to a health facility for tests.
Walinipima kama niko na HIV na sina. Walinidunga sindano ya tetanus. Huko ndo nilikuwa nakaa peke yangu kama home.
She and her mother were cancelled at the health center and at the children's office.
Wakiniambia si makosa yangu. Ni makosa ya huyo mtu. Sasa nilipelekwa children's office. Mamangu venye aliitwa alifanywa counseling, akasema hataki kuniona. Ndio nikaletwa hapa.
At the safe house, Florence and volunteers ensure the girls attend clinic without fail during the prenatal and postnatal season. But they have to be creative with the visits so as to encourage the girls to keep going.
We make it, clinic day, we make it as we are going out. So some will look at it, we are going out. But when we are almost at the clinic, then it is like, should we go to the clinic early in the morning before anyone else comes? Or should we go late at evening when people have left clinic?
So it's also the fear. We've created an environment where people cannot speak freely about issues about sex, sexuality, and sexual violence.
The girls use public health facilities since they are cheaper and they do not have medical cover. Once the prenatal period lapses, a new challenge awaits: the birth period.
Kwanza nilienda Bahati, nikapimwa, tukaambiwa twende Pumwani, nikaenda Pumwani, nikajifungua saa 6.
Due to their young age, some of the girls Florence handles are so traumatized by childbirth, they get depressed thereafter.
I had a 12-year-old who was pregnant, and at 13, she delivered twins. And this is a young girl, so I think she bled too much and she went into a coma, and so much happened at that time. But when I went to ask at the hospital, and then the senior superintendent, hospital superintendent, just told me, you know what, madam, when a woman comes through the gate of a maternity hospital, she's no longer a child. She's a woman.
The training for youth-friendly services to healthcare service providers has been ongoing.
A 2015 policy on adolescent and sexual reproductive health states that adolescent mortality rates on average from developing countries shows that pregnancy and delivery complications, including unsafe abortions, are the second leading causes of death for girls below 20 years. This policy is scheduled for review.
The former policy, we didn't focus more on the different services for adults and minors.
When we talk about sexual reproductive health services for adolescents, we talk about it from a prevention side.
Angela Nguku is a champion for quality maternal care for all women. She believes that adolescent mothers face challenges accessing maternal care because of the way the system is set up.
Our maternal health system has been formulated in such a way it addresses the adult mother. But when it comes to adolescent mother, it is not formulated for that. And so listening to these girls, what they told us is that when they go to that health facility first, they will go once and not go back because they are still discriminated by the fact that they are young.
They are children. They are not adults. What do they need? They need special care because even their body is, some of them, their bodies are not mature enough to handle the pregnancies.
The Ministry of Health says that youth-friendly services are available, but in very few facilities.
Like the youth-friendly centers, they can be standalone because then it's easier for them to be able to visit those centers and get the services.
At the moment, there are no special maternity wings demarcated for teenage mothers. Counseling, though required, is not guaranteed.
At the facility, not much happens. So it is upon me and my team to look for counselors, because sometimes the girl delivers and she doesn't want to breastfeed. So someone has to talk to her.
If we are not prepared enough in terms of mental health, then we end up re-traumatizing the child and the family, and then you get people relying on coping mechanism like use of drugs and substance abuse.
You can't separate mental health from any other service.
Also, the babies the girls deliver serve as the missing link in bringing perpetrators to book.
And then the girl remains with the baby. And you know, that is what most parents don't want. And they will say that the perpetrator has been arrested and the perpetrator is the father of this baby. You know, now who is going to take care of this baby?
These are the dilemmas that adolescent mothers and their families face on this agonizing journey. On World AIDS Day, President Uhuru Kenyatta called on Kenyans to be more decisive in dealing with perpetrators of defilement.
Hata tukisema ati huyu akishikwa afungwe, afanywe nini, hiyo haitasaidia. Ile itasaidia ni sisi tubadilishe tabia zetu.
This booklet by the Ministry of Health targets adolescents with the main aim being to help them understand their sexual and reproductive health needs. It will be launched and distributed across schools this December, just before the holidays. As Kenya struggles to implement policies and commitments made to reduce teenage pregnancies to below 10% by 2030, access to age-appropriate sexual and reproductive health education, as well as facilities to cater to adolescent needs, requires more work. Progress that can be achieved through collaborative efforts by the Ministries of Health and Education, as well as county governments and parliament before deadline. Mashirima Kapombe, Citizen TV, Nairobi.